72-year-old male with prepatellar bursitis going on for maybe a couple of weeks. 3 months ago he fell directly on the knee, but didn't really think much of it at the time, and basically just over the past couple of weeks developed some swelling. There's no pain. His knee exam is pretty unimpressive other than the swelling over the patella. So we're going to go ahead and do an ultrasound guided aspiration and cortisone injection.
Here we're going to look at this fluid collection in a sagittal plane. And here we can see the patella. We can see this very thick-walled fluid collection. The fluid is very compressible. He didn't have much tenderness going against prepatellar bursitis, but then again, this fluid collection didn't really extend beyond the prepatellar bursa going against a Morel Lavallee lesion, but it could be a Morel Lavallee lesion where he had to close the gloving injury of the soft tissue over the patella. So here it is looking at it in an axial plane. Again, you can see this fluid collection. There's some synovitis, even perhaps some subcutaneous fat that got dislodged within this fluid collection, and that would be more consistent with a Morel Lavallee lesion. There may be some septi as well within this fluid collection. Again, he wasn't tender with probe pressure going against an acute bursitis. So here we are starting the procedure. We're using an 18-gauge needle with a 10 cc syringe. And we basically filled up just about the whole syringe with this bloody fluid. Looked more like serosanguinous blood-tinged fluid, which would be more consistent with a Morel Lavallee lesion. Here you can see the needle going in on the proximal aspect of this fluid collection, or cephalad aspect, I should say, of this fluid collection. And there's a pretty good reverberation artifact of the needle. And as we're aspirating, the tissue planes converge on themselves, and then you got to pull back on the needle in order to keep that tip in that black zone or that fluid. And this way you can get just about all the fluid out. Here we are, we're just on that very cephalad part of the fluid collection, and we're pulling back on the needle in order to get that remaining couple of cc's of blood-tinged fluid out. And actually this was more bloody fluid than blood-tinged. And here we are putting on cortisone, about a cc of normal saline mixed with about 5 milligrams of triamcinolone. And here you can see the injection of the cortisone within this potential space, or perhaps within this prepatellar bursa. And since I wasn't sure exactly whether this was an actual bursitis versus a Morel Lavallee lesion, I decided to inject him again with this small dose of cortisone. I spoke with the patient a few days after the procedure, and he was doing quite well, with no significant complaints of any knee pain or swelling.